Hi, you guys. Welcome back for our daily practice questions. It is day 253, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all of the resources that I offer. But I always like to direct you here as well, where you can find my business profile simply by going to Google and searching The Nursing Studio. It will show you the contact number, the link to my website, as well as testimonials from previous review students. All right, y'all. Question number one for today. A 65-year-old male with a 45-pack year smoking history is diagnosed with moderate COPD, gold stage 2. He reports daily symptoms but no hospitalizations in the past year. What is the most appropriate pharmacologic management? Is it A, SABA only as needed? Is it B, a LABA or LAMA daily with a SABA as needed? Is it C, a LABA plus an inhaled corticosteroid combination? Or is it D, oral prednisone taper? Take a moment and tell me what you got in the comments, y'all. All right, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate pharmacologic management? And I tell you, if you're just looking for a treatment, you need to run it back and see if they provided you with a diagnosis. Here, the question it lets you know this is COPD stage 2. So think about how you treat stage 2 of COPD, right? And your best answer is going to be B. You're going to have your short acting, so your SAPA as needed. That's always going to be on board. It's your rescue inhaler. And then you're also going to provide a LABA or a LAMA, either one, because you need a long acting as well. Now, of course, if it's flu season, we're going to continue flu vaccine. So if they tell you it's October to March, you want to make sure you get the flu vaccine because they already have a chronic respiratory condition. So you don't want to have any other um, lung issues or complications because it can be more fatal for them or more detrimental. So making sure you get that flu vaccine, as well as in stage 2, we do pulmonary rehab. And y'all know Brittany's Brilliant says pulmonary rehab is 2 words. We give it in stage 2. But this question asks for pharmacologic management. So we're going to go with B, our short acting and our long acting. Okay. Question number 2. A 32-year-old, otherwise healthy woman presents with fever, cough, and a chest x-ray confirming community-acquired pneumonia. She has no comorbidities. What is the recommended first-line monotherapy? Is it A, amoxicillin or azithromycin, B, levofloxacin, C, azithromycin plus amoxicillin, or D, ceftriaxone IV? Take a moment and tell me what you got. All right, and stem of the question states, which is the recommended first-line monotherapy? So again, it's looking for a treatment. Does it provide you with a diagnosis? And there is a provided diagnosis of community-acquired pneumonia. So what is your first-line therapy for community-acquired pneumonia? Your best answer is A. It's asking for a monotherapy, mono being 1, right? So with monotherapy, we can go with azithromycin or amoxicillin. And then lastly, question number 3. A 58-year-old male with diabetes and COPD presents with fever, cough, and new infiltrates on chest x-ray. He is stable for outpatient treatment. What is the most appropriate first-line dual therapy? Is it A, amoxicillin only, B, doxy only, C, amoxicillin plus azithromycin, or D, ceftriaxone plus levofloxacin? Take a moment and tell me what you got, y'all. All right, and the stem of the question here states, what is the most appropriate first-line dual therapy? So again, if they're asking for a treatment, look to see if they provided you with a diagnosis. And we have a diagnosis here being community-acquired pneumonia. Well, you really need to look at these assessment findings because it doesn't specifically say the diagnosis here. So let's run it back and look at the assessment findings. So this patient is 58, has diabetes, COPD, and comes in with fever, cough, and new infiltrates on the chest x-ray. Those infiltrates on the chest x-ray is confirming that community-acquired pneumonia diagnosis that you should be thinking, especially somebody with a respiratory history, as well as presenting with this fever cough, the new infiltrates chest on the chest x-ray will let you know community acquired pneumonia. Now, dual therapy will be more beneficial because although this person is under the age of 65, they also have COPD, right? So you have a respiratory disorder, so you do want to try to give them some dual therapy to give better coverage. So I like to tell y'all, like a lot of times, if the person is young, healthy, no other comorbidities, monotherapy is typically fine. Someone in this scenario who may have some things that give you like risk factors that may warrant a little bit more coverage, dual therapy can be beneficial. And then, our elderly who might have been on antibiotics recently, things of that nature, then you want to pull out the big guns, right? So in this scenario for our dual therapy, dual meaning two, you're going to do C, your amoxicillin plus your azithromycin, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as I mentioned previously, my website is also linked in the description of this video. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.